So, good morning, dear ladies and gentlemen. Thank you for your time to join our today's webinar, KaVo World of Smile, KaVo Instruments for Prophylaxis. Before we start with our topic, a few words about myself. I'm with KaVo almost 30 years now, have been working in different positions, and since quite a few years now I'm a trainer in our training team for dentists, universities, distributors, and my focus products in trainings are the instruments and treatment units. So let's start with our today's webinar. We will have an overview of the products which can be used for a successful performance of prophylactical treatment, and always also giving a hint about the so-called KaVo World of Smile, which provides a combination of instruments and consumables which can be easily used for a successful workflow in prophylaxis. And as any treatment, a prophylactical session starts with the preparation of the patient, and here we do provide some, of course, hygienic materials as single-use protective shields, but also the OptiView for a better opening of the patient's mouth in order to provide to the dental hygienist or to the dentist a better overview of the working field. And then step by step we do have a combination of KaVo and Kerr products for performing the prophylactical session. KaVo, as a specialist for mechanically driven instruments, provides a scaler for mechanical calculus removal or debridement. We do have products for air polishing in the different ways of application. Of course, traditionally, as a manufacturer of turbines and contra angles, we provide an extremely wide range of polishing contra angles for different applications in prophylaxis. And last but not least, a successful prophylactic session can be ended by a safe and simple to make diagnosis of the tooth status. Let's start with one of the most successful over many years KaVo products, the AirScaler SonicFlex. The AirScaler SonicFlex, since, as mentioned, many years, is a very successful product which both dentists and dental hygienists like to use in their everyday work. Why? The first point is it is very easy to attach. Since you do have a quick turbine coupling on your treatment unit, on the air tubing of your treatment unit, you can attach the SonicFlex when it's required easily to the KaVo Multiflex coupling. The design of the handpiece itself is a very modern one. We do have a hygienic and easy to grip Plasmatec coating on the handpiece itself, which allows you in all conditions to work in a safe and best comfortable way. Of course, we do provide the SonicFlex in versions without and with illumination. And when we go for the illumination, we follow our traditional glass rod illumination Lux 3, which is supported by the light source from the multiflex coupling. Nowadays, in many cases, this is, of course, LED illumination for a very homogeneous and safe control of the work. In regards to the use of the SonicFlex in different indications, we provide a most simple way to adjust necessary power settings. Directly on the handpiece, we do have a rotatable ring which helps you to select the suitable power setting depending on your indication and individual patient situation. We do have a setting for an extremely soft and gentle treatment. We do have a medium setting for most standard applications, and if required, there is a possibility to significantly improve, accelerate the power in order to achieve the necessary treatment result. One point why the AirScaler Sonic Flex is so popular in both dentists and dental hygienists' use is the way how do the tips of the Sonic Flex move. We do have here a so-called oscillating movement compared to other ways of movements of tips in other mechanical scalers. And this oscillating movement allows to have a very smooth and conservative treatment. As we will see it, it is more easy to adapt the working area of the tip into the oral cavity, onto the tooth, into the area where you like to treat something, in order to achieve the result without harming some adjacent substances, soft tissues, and so on. You might ask yourself, why do we have two of these scalers? And no, this is not just as this ring here does have a different color. We do provide in the Sonic Flex version with this brownish power adjustment ring, we provide a very innovative quick tip thread. That means if during the treatment it is necessary that you change the tips, this can be done much faster and more convenient compared to the standard tip thread we provide in the Sonic Flex with this silver or chrome colored ring, where we do have a standard tip thread, and maybe some of you know here you would have to twist the tip up to 10 times until it is fixed or loosened again. For that reason only, the Sonic Flex with this brownish ring has got the name Sonic Flex Quick. So if you read or see this wording Sonic Flex Quick, it has in mind that here we provide an additional treatment comfort. The technology of both Sonic Flexes is 100% the same. Usually, these air scalers are being compared with ultrasonic and mostly piezo scalers. I believe that most of you are aware that an ultrasonic piezo scaler is doing the motion on a very high, on an ultrasonic frequency. That means we do have here 30,000 movements per second in a very short range of movements. So this is a linear pattern of movements which happens extremely fast in very short distances. Compared to that, as already mentioned, the air scaler as an air-driven instrument is working on a lower frequency. The frequency here is depending on the adjustments of the treatment unit in the range from 6 to 6,500 Hertz, but the amplitude in the elliptical motion pattern is much wider. While here we have this very fast and very short linear stroke, here the oscillating pattern is depending on the selected power adjustment from 120 micrometers over 160 micrometers to a maximum of 240 micrometers. And as we do have a different drive technology, here it is electrical drive, ultrasonic behavior. Here we have air drive with the elliptical motion. We achieve a different result of the tips on a tooth area. While on a piezo ultrasonic scaler, the vibrations are easily, simply said, bundling in waves. You can see it here on this research pattern on that, so you can see very nicely how the ultrasonic motion is bundling here in waves. We can follow on this picture here those just bubbles inside a liquid, which give an idea about the point that all working surfaces on the selected tip are active ones. And this is a point which allows to use the Sonic Flex air scaler in a wider flexibility in how the tip is being adapted to the tooth in the different working areas, while in piezo scaler the user has always 100% to look after the very safe application in the right angulation, and this angulation is very slim to the selected treatment area. Here we do have a higher flexibility due to the elliptical pattern. And as the amplitude of the motions is wider, we do have this elliptical stroke, which is, for example, going over the calculus and just breaking the structure of the calculus, while here in those very fast motions over a short distance, we have like a scraping motion, which of course also in this way is breaking the motions breaking the calculus on the tooth, for example. Since we saw that the working ends of the tips are the active areas, it is a significant point to look after the tips themselves, whether they are still in working condition or not. Unfortunately, it is still the situation that we receive some complaints, the scaler is not working anymore, and if then the situation is checked, we do see the tip might look like that. So this is not two different tips. You see both have here, for example, the same number. It's the standard universal scaler tip, but the lower tip here on the image is completely worn out. And with such a tip, you cannot work anymore in a good way. You cannot achieve the required treatment result. And all of you know, when we then tend to push the handpiece more powerful to the tooth area, we can of course cause some damages, maybe in some treatments even some pain perception in the treatment, and of course there is always in faster wear of the handpiece itself. In order to be always on the safe way, we provide to all our scalers this wear indicator card, where the assistant, latest in the hygiene room before the reprocessing, should check whether the tip still is in working condition. And we do have here a simple traffic light system, and you see when the working end, which in the air scaler is maximum 2 millimeters of the tip, has reached the red area, the tip must be thrown away and a new fresh tip should be selected. We provide a very broad range of tips for the sonic flex, and in prophylactical treatment, of course, the most often used tips are the tips for supragingival scaling. These are the standard scalar tips. We already saw one of them on the pictures before, and this is the tip number 5 with the standard shape in order to reach as well as smooth flat tooth surfaces, cervical areas, and also partially interdental areas. In case there is a higher requirement to really go into the interdental spaces, we provide the sickle shape, which allows to go in a more convenient way, especially into interdental areas, or in some treatments as the tip itself, because of that design, is longer, reach the area in going over a certain tooth and still being able to remove the calculus over there. And we do provide also within the scalar range of tips one tip we traditionally still call perio, but it is to be applied in the healthy sulcus. That means with that tip you can go up to maximum 2 millimeters into the healthy sulcus. I would not call it really sub-gingivally, and remove in a gentle way some very, very strong calculus over there. What do all these 3 tips have in common? It is their shape when we would do a cross section, for example here in the working area. They do have a so-called rectangular or rhombic structure. That means we do have really the possibility, you see it here a little bit on this magnified image, they do have a surface which can, in a very gentle but very efficient way, destroy the calculus layer on the tooth in those wide stroke but slow oscillating movements, which are applied then in different power settings. Maybe you paid attention to the point here on the slide that you do have to all tips always 2 versions. For example, here a number 5 and a number 5A. This is just the differentiation in regards to the thread. The tip without any letter behind does have the long standard thread, and the tip with the letter A behind the number is the tip for the sonic flex quick with the short thread. That means when buying some new tips, or when making the preparation for the treatment room, for the prophylactical room, the assistant would have to pay attention to this letter, which is of course marked on the tip itself. Beside the supragingival scaling, since many years we also provide a set of tips for sub-gingival scaling or debridement. And those tips we call perio or pero. They do have a completely different design compared to the scalar tips. It is not only that they are here in this area much longer compared to the scalar tips, also when we would do a cross section through the working ends of the tips, we will see that they are completely rounded. This special shape does allow to bring these period tips subgingivally into pockets as deep as you might consider it is necessary. From the scientific proof, and of course before we started launching such tips, there was always scientific work on that. The length of the tips could go into pockets up to 8-9 millimeters depth. But of course, it is up to your clinical diagnosis and treatment decision whether you still would treat such deep pockets in a conservative, non-surgical way. We do have 3 tips which are included into this perio set. One of them is so-called straight, and 2 of them, the number 62 and 61, are slightly curved. And you see it here nice on this image. Those curves allow to really go into all pockets in different quadrants, in different areas of the tooth, of the root, and being able even to reach interdental spaces. In case there is an additional demand, especially for a very, very soft interdental scaling in a subgingival area, the straight tip with the number 60 can be very helpful there. When looking purely into a very systematic workflow of application of those perio tips, 2 tips would be even enough. And this is the tip number 61 and the tip number 62. These are the 2 curved tips which could be used in a systematical workflow with starting from the buccal side of one jaw over the interdental area of the first teeth, continuing then on the palatal side and moving then vice versa again over the buccal side and finishing on the lingual side in the lower jaw. And the tip number 62, of course, is doing the same workflow in the mirrored areas and allow the user to be very, very systematic by changing the tip only one time, and making sure that all areas are really being reached there. Of course, especially, but not only, but especially when working subgingivally, it is essentially necessary to follow a very careful technique. That means the working end of the tip must be applied almost parallel to the root surface in order not to damage neither the root cement nor some maybe still existing Sharpase fibers inside the periodontal pockets, but allowing a very good calculus biofilm removal there. And here you see how it would look like on a model here, how theoretically when you apply the tip from outside to a treatment area it would look like. And here you see how it will happen when the tip is really brought into the periodontal pocket itself. In the meantime, also in the prophylactical treatment or in periodontal recall treatment, we have more and more patients with implants. And of course, also as on natural teeth, there can develop an inflammation, the peri-implantitis. And the perio tips, which are metal ones, should never ever be used in a biofilm removal into a scaling on implant surfaces. For this purpose, we do provide a special tip with the name SonicFlex Implant. It consists of a holder and single-use acrylic tips. So single-use means single patient use. Of course, not single tooth use, but single patient use. Those little inserts are being screwed into the holder, and with that acrylic tip, the peri-implantitis can be treated in a very, very gentle and substance-sparing way without doing any damages to the implant surface itself, and also to the attachment of the soft tissues around the implant. When I prepared for this webinar, I just went into Google and looked for some pictures, and I found a very nice report, a clinical report from a German dentist, Dr. Zellman, and you can see here application of the implant tip around an implant. So here in the lower area of the slide you do see the source. Of course, he is giving here some recommendation, sharing experience of his periodontal recall in case of peri-implantitis. So some nice pictures how the implant tip is being applied, and then the situation after the treatment, and the situation how the soft tissues could heal and allow again to have a good attachment of the soft tissues to the implant itself. Maybe you will also find, when you go into Google in your country, some clinical reports, and can educate yourself a little bit more. As mentioned at the very beginning, the SonicFlex does provide not only tips for prophylactical use as the scalar tips or the perio tips or the implant tips. It provides a very, very broad range of different tips for different application. That means one of the success factors of the SonicFlex is not only the fast adaptation on the turbine coupling multiflex. It is not only the gentle way of use, it is the universal and flexible use of this handpiece in also different fields of application. And here we do have a broad range of tips for micro-invasive caries treatment, where diamond-coated tips allow to do a very gentle enamel preparation, access to some cavities without destroying too much of sound tissues. We do have special tips which can be helpful in bigger restorative therapies, which can do a very nice beveling, finishing of cavities for inlays for different restorations, or a crown finishing preparation. We do provide tips for endodontic treatment in both ways, orthograde and retrograde. And last but not least, there is a broad range of even surgical tips for different applications, as bone window preparation, support for some augmentation therapies, and also crown extension, aesthetical or functional treatment. So after we have removed the calculus, in the prophylactical session very often follows the air polishing, which allows to remove some miniature calculus particles still on the tooth and bringing the teeth to shine by removal of plaques, discolorations from tea, coffee, and so on. We do have for this type of treatment the Prophylaxis in our portfolio, and since now almost 2 years we provide the latest generation of this Prophylaxis, the Prophylaxis 4. This number 4 just says it is the 4th generation. And when just looking onto this product picture, we do see we paid attention here also to the requirements of many dentists or dental hygienists to have for the prophylactical treatment available an instrument which looks a little bit more nice from the color point of view when the patient is, for example, looking onto the treatment instruments. What are the highlights of the 4th generation of the Prophylaxis? Of course, the Prophylaxis again can be adjusted to the multiflex coupling the same way as the Sonic Flex does. That means here also in the workflow, the change of the instruments happens very, very fast. We have significantly improved the whole range of ergonomic requirements for the air polishing handpiece itself. That means we changed a little bit the design of the handpiece in the area where the Prophylaxis is being rested inside the hand of the user. We allow to select a handpiece sleeve here depending on the anatomical shape and size of the user's hand. Of course, this holding part is rotatable, the same as it was in previous generations of the Prophylaxis, in order to give the best comfort. We do have here a completely new cannula. We will see it later on some slides where we provide to have a much more focused powder jet powder stream and also a softer powder stream in order to be very, very safe to the enamel, even in the very sensitive cervical area when some plaque, for example, is being removed. And of course, we are still considering the complete workflow in order to allow the assistant or the user to fill the reservoirs in a simple way with a flat construction of the powder container itself. And when we speak about the ergonomic comfort, you can see it nicely here on this picture, where we see that the Prophylaxis 4 is perfectly rested in the hand of the user. The user can grip the handpiece in this rotatable part in a very, very safe way, and the flat design of the handpiece itself allows to have a perfect access to the working area. And just for making this point more visible, I took a picture out of the brochure of the predecessor. It was the Prophylaxis 3, and maybe some of you are familiar with that handpiece. You see, this user is holding the instrument in a perfect way. Everything is fine in regards to the ergonomics. But when you compare these two pictures I am sure you immediately will confirm that after some times of use here, there might be an additional stress of this little bit overweight in the rear part of the handpiece in the user's hand. Yeah, and here, of course, we do have perfect match to all anatomics. And also on this picture, you can once again see the ergonomic comfort of the Prophylaxis for even compared to our predecessors model, the Prophylaxis 3. The whole handpiece is much shorter. We have reduced the size here also of this rear part, where there might be a little bit an overweight in some user's hand, and beside the change of this little curve, we see the significant difference in the holding area, where the Prophylaxis 4 is much shorter, and in addition to that, users with very, very small hands could just select the very short handpiece sleeve, just click it on here, and with that making the handpiece most comfortable for the individual use. Of course, these two different grip sleeves are included into the standard scope of delivery. That means they are available with any handpiece. So, one of the biggest benefit in the clinical application of the Prophylaxis 4 is the completely new cannula with an integrated mixing chamber of the powder stream together with the water and the air inside the cannula itself. We do see here on this picture that the powder stream is an extremely slim one, and this helps to be very, very clear in finding and targeting the powder stream to the area where the discoloration should be removed, where the plaque should be removed. That means we preserve the tooth structure from some unforeseen situation that the powder is targeting an area where it is not necessary. And in addition to this clinical aspect, we do have an user aspect which provides additional comfort and also safety. Since this powder stream is much more focused, we significantly reduce the powder mist. That means the dental hygienist or the assistant can follow with the suction nozzle in a much more controlled way, and you can reduce the amount of the overspray that is creating in the oral cavity, or of course is also around there. And this fact is, I'm sure, a very significant one, especially when these days we are again focused on the topic of keeping aerosol cloud as small as possible, and to provide a best hygienic safety in this application. If among you are users who say, oh, I'm very satisfied with the power performance of the Prophylaxis 3, and I like to continue the same way, we provide as an accessory a so-called power cannula. The power cannula does provide the same technology as the cannula in our predecessors, Prophylaxis 3 or even Prophylaxis 2. That means we do have here a traditional powder stream with more power, and I believe you can even recognize that on these two trial pictures. Here on the lower picture you do see the Prophylax 4 slim powder stream with a reduced overspray around there, so you can see it, while here this picture showing the stream from the power cannula, we see a wider powder jet, and we do see, of course, significantly more collected amounts of powders. That means the overspray inside this trial area, but the same, of course, would happen inside the oral cavity of the tooth. Yeah. So please remember, the power cannula can be reached as an accessory for the Prophylax 4. In the standard scope of delivery is the innovative, very gentle and slim focused tip. As well as accessories in the prophylactical treatment, we allow the dental hygienist to do in sub-gingival air polishing by use of the perio kit. And beside the increased comfort of the Prophylax 4, we also reduced the amounts of necessary accessories for adjusting the handpiece to the periodontal air polishing way. In the Prophylax 3, for adjustment of the perio tip, there was still required, beside the holder for the tip, also to change a nozzle in the rear of the handpiece itself. Here the adjustment happens in a different way. I'm going to show a little bit later. So the tip itself, the perio tip, which is a part of this perio kit, reminds us the design of a perio probe. We do have here also the marking on, and when the dentist or the dental hygienist has done the probing, has checked the depth of the pocket, he or she will find the marking for this required working depth also on the perio tip itself. That means this bulk black area, or this ring here, helps also to keep the control that the sub-gingival air polishing would happen in the allowed depth, working depth of maximum those 3-4 millimeters, and not going deeper into the periodontal pockets. And of course, the powder stream itself is again following in the direction of the tip in perpendicular way to the design of the tip, to the tilting of the handpiece into the periodontal pocket, and thus allowing the user in very, very good control where the biofilm or some concrements are being removed. So the tip is being added in a very simple way. You of course select this holder and you screw on the perio tip itself. The perio tip can be autoclaved. That means it can be used for multiple patients. We say up to 10 times of use are allowed. After that, the thread, the right fixation should be checked whether the tip still is sitting in a correct way. The handpiece itself can be made very, very flexible for the different indications by changing the grip sleeve, by changing the required tip in combination to the indication that needs to be treated. And of course, we provide, as we do since many, many years, various powders for the different ways of treatment. In subgingival treatment, we still do provide the traditional powder sodium bicarbonate. In the KaVo range, it is called Prophylaxis powder, but since more than 20 years, we provide now in more comfortable powder we call Profi pearls. This is calcium carbonate, and those round particles help to preserve the tooth substance in a much better way, and they help to remove the calculus, the plaque, and the discolorations in a much more efficient way. Both supragingival powders have to be used from red to white, and the Profi pearls even allowing to have a more flat application angle compared to the sodium bicarbonate, as they are really floating over the plaque, saturating with the plaque and removing the plaque in a much more efficient way. For the period treatment, the pocket treatment, we do provide a glycine powder, which is much softer. Here the grid size, for example, is just 22 microns, while in the supragingival powders we do have a grid size from 60 to 70 micrometers. In the meantime, many hygienists are even tending to use the period powder also for supragingival treatment, as the very soft glycine powder allows to remove even supragingival plaque in a more delicate way than the standard powders are doing. So you have the option depending on the individual patient situation, and of course a patient with a higher amount of plaque on the teeth would require a little bit more efficient treatment, while the just little plaque areas would allow a glycine treatment, for example, also supragingivally. So how now to adjust the handpiece itself for the different treatments? In a quite similar way as we saw it before on the Sonic Flex, we provide on the Prophylaxis handpiece itself in a turnable ring where power settings can be selected. And those power settings change the amount of cleaning powder. That means you can determine the intensity of your plaque removal work, but you can also control a little bit, in addition to that, the powder stream in combination with the work on the foot control of the treatment unit. And these symbols, a little bit looking all together like a triangle, give a simple indication. On the highest level, you can treat all supragingival situations in a very efficient way. In the medium level, there can happen also, of course, supragingival treatment when there is, for example, not so much plaque, but you could also use it for the subgingival treatment with glycine exclusively than in periodontal pockets. And the lowest setting helps to improve the workflow significantly, as here almost no powder is coming through the handpiece itself, but in directly the application of the tip, you can rinse off powder leftovers from the teeth, and much faster having a visible control where still a treatment would be necessary. The workflow preparation of the Prophylaxis helps to fill the reservoirs and cover them with a differently colored lid, so the user can make it very suitable and very easy in the clinical application. And after the treatment, immediately the handpiece could be blown through in order to move out some powder residues in a simple way in order to avoid any clogging. Accessories are supplied to clean the straight handpiece channel in a very simple way, even in the worst case that there would happen in persistent clogging. The channel can be cleaned in a very simple way. The Prophylaxis 4, also as the Prophylaxis 3, for example, is completely in all different parts and also in the accessories fully reprocessable. That means all parts can be internally and externally washed in thermal disinfector, and they can also be autoclaved. And this is a very significant safety topic for the Prophylaxis 4 in the daily use. When the tooth was treated with the air polishing, it should finally be done in polishing in order to remove some still maybe powder residues from the tooth and bringing to a final shine. Maybe some of you do not like to apply an air polishing device and do the polishing in a traditional way with contra angles and different polishing pastes. Again, we do have here a combination of products, KaVo and Kerr, while we are providing the different contra angles and the Kerr range, the polishing pastes and different types of polishers. Most of you do have different habits. How do you like to polish? Which way and which types of polishers do you prefer to use? And we can cope with our range of polishing contra angles, different habits you might have from your daily work. If you prefer doing a rotary polishing, we provide you two types of handpieces which give the possibility to have snap-ons or screw-ins as polishers. Those instruments, those contra angles do have the number 31 in the KaVo portfolio. And here I would like to focus on this Smatmatic Profi. S stands for Smatmatic S31, which is in addition to the rotary polishing with either snap-ons or screw-ins, is giving the user again an additional comfort, especially when he has a smaller hand, as this contra angle is extremely slim and lightweight and very comfortably to hold in the hands. Out of the traditional portfolio, we have, of course, the Expertmatic instrument, also with the number 31, with the same performance. Some of you already preferring single patient use polishing heads, which provide an additional benefit for the following reprocessing workflow. And here we do have an holder handpiece with the number S19, which can take single-use polishes in rotary motion. And out of the curl range, here we do have the different types of the perfect pearl adapters, which provide a very powerful and reliable but also gentle polishing work by the Pro Cups. Inside the Expertmatic range, we do have an instrument with the number 61, which is doing a so-called filing stroke motion, which ideally can also be used for interdental polishing with inserts from the company Dentatus. So the polishing laminar inserts are helpful to be used in a gentle way for interdental polishing in stroke motion over 0.8 millimeters. And this handpiece, this contour angle can also be used much more flexibly for also some finishing, beveling, stripping work with inserts, for example, of the company Intensive with one side laminated, diamond coated different file inserts. Some of you might prefer a so-called oscillating polishing, and here we do provide again two versions of contour angles out of our Smartmatic range portfolio. They do an oscillation by 70 degrees and are suitable either with the number 33 for snap-on polishers, which are just being snapped onto this holder, or if you prefer to use ledge type polishers, they could be inserted easily into the contour angle with the number 53. In the KaVo Curl world of Smile, we provide in various countries so-called Profi boxes, where we just offer the possibility to give the dental hygienist in kind of a starter kit in combination of one selected contour angle with a starter package of consumables. That means polishing pastes, polishers, and also the OptiView. If you have an interest in such starter kits, Profi boxes, please ask your KaVo Curl product specialist or your distributor for also the very attractive prices for these Profi boxes. If you are traditionally using KaVo contour angles in your daily practice, you might have a collection of some shanks over the years, which maybe still are in your drawers and not in the daily use. Of course, you can reuse them also for prophylactic treatment by combining them with some heads out of the Mastermatic Lux Intra-Head range by having also different motions. Rotary motion, stroke motion for interdental polishing with the laminar strips, or reciprocating oscillating motion as we just saw before. You can do your right selection on having a look into the different 3 series, the same as you maybe select your restorative portfolio of instruments as turbines or blue contour angles, and depending on your individual prophylaxis concept, whether you have an own prophylactical room with dental hygienists, or maybe you implement the prophylactical treatment into your dentist's workflow, depending on the user ergonomics, that means the anatomical shape of the hands of the user, the preference of the workflow, and of course, if also looking from the workflow point, from the economic point into the practice, we help you to have the suitable amount of instruments for your prophylactical workflow there. And last but not least, as in all KaVo instruments, we allow you inside these series to make the right choice depending on your individual budget. So the prophylactical session now is completed. You have perfectly cleaned teeth, but of course you would like now to motivate your patient for a good oral hygiene at home in order to keep the good treatment result. You like to receive patients' compliance for some additional work steps in the oral hygiene procedure. You like to confirm your treatment results. You maybe like to detect some changes in the teeth at a most early stage. And last but not least, you like to receive the commitment of the patient when you communicate some necessary treatment plans. That means there would be required a type of a diagnosis, not only from having an outside look, but also an internal look into the teeth. We provide, by use of the Diagnocam, a very simple and very comfortable way to have a safe look into the teeth in order to see even minimal changes there. The Diagnocam is working on a so-called near-infrared transillumination, and this near-infrared light is being absorbed inside tooth structures and giving visible pictures which are easily to diagnose for the user and easily to understand in the patient's communication. Here, this spot, for example, gives a clear indication that there is a decay happening. And the very beneficial point of the Diagnocam is that this near-infrared transillumination helps you to detect decays at a very early stage. So this is already in deep decay, but we will see at a very early stage in the proximal area in a radiation-free way. That means in every treatment situation you can transilluminate the tooth and cross-check whether there is an ongoing decay in the proximal area. Of course, occlusal caries can be detected as well, secondary caries around fillings, and some invisible cracks in the enamel in either non-treated or treated teeth, for example, with a class 2 restoration. The Diagnocam is very easily to apply onto the tooth. There is just two kinds of lips which are being brought over the tooth itself, over the gingiva, and on a monitor the user can directly follow the treatment itself. It can be easily applied to the lower, to the upper jaw. If necessary, the second hand of the user can support the handpiece itself, but this is not obligatory. And especially after the professional tooth cleaning session, you would like to give the patient the confidence in the treatment result and in his oral hygiene at home. And with the transillumination, even such small beginning decays, demineralizations in the proximal areas can be detected, which are still to be treated either with only prophylactical measures and only when the decay has already touched or crossed the enamel dentin junction, then some minimally invasive treatment steps could be agreed with the patients. Very often you can on X-rays see decays just which are already looking like that, and on an X-ray they still look like minimal ones, but it is an established dentin caries already. And we allow here in a safe way and in a radiation-free way to detect caries at a very, very early stage. Of course, the DiagnoCam requires a software use, and the software gives some supporting points for an ease of use as a recording assistant, which is giving the user the hint that you have the best focus reached in applying the camera. We do have a tooth scheme for both adults and child dentition in order to store the images in a safe way. Teeth can be categorized in critical, monitoring, healthy or missing status, and as, for example, also in X-ray softwares, we do have the possibility to do some visualization in showing the patient by some arrows, for example, some markings. That means the DiagnoCam allows to finish the prophylactical session in a very safe and convenient radiation-free way. It can be applied by the dental hygienist, but of course the diagnosis has to be done by the dentist later on. The DiagnoCam use is very, very easy to learn. It is simple to use. We do have scientific proof, and we do have, beside the own software, different ways how it can, for example, be also used in your X-ray software, for example. If you like to learn more about clinical aspects of the DiagnoCam in our KaVo Academy, we just recently run on 13th of May a brand new, very new web training for the near-infrared transillumination, and you can recall this recording at any time there. So that means we had a look, an overall look, how do we can go through the different work steps in prophylaxis in combining KaVo products. We of course focused on the KaVo products, beginning in the mechanical scaling in sub-gingival way by the very flexible use of the Sonic Flex. We continued with having an overview of the use of Profi Flex 4 in air polishing, again supra and sub-gingival way. We got an impression about the polishing contra angles inside the KaVo portfolio in combination with polishing pastes and polishers, and we finished our prophylactical session with giving an impression about the near-infrared transillumination in the KaVo DiagnoCam as a radiation-free method for a very safe and convenient patient's communication. So, I would like at this stage to thank you for your attention, and would now open the session for the questions from your side. So I do see different questions there. There is one question from the Middle East area. Can we find out in dental supply those instruments? Yes, you can of course ask the distributors in your area in Middle East. For example, in different countries, we do have Al Hayat, we have Mazar, we have in Saudi Arabia Algiers or others, or you contact our colleagues in KaVo Kerr Middle East and getting the right contact there. There is a question about the sterilization of the instruments. Of course, all of the instruments, Sonic Flex, Profi Flex and the polishing contra angles can be fully reprocessed. That means they can be washed in a thermal disinfector or washer disinfector and can be autoclaved. The contra angles must be lubricated before every sterilization. We do have in near future a session about the hygiene maintenance of the instruments, also in the KaVo Academy, and if you like, you can have a look into this webinar as well to learn more about the details. But let me just once again point out, especially with the Profi Flex 4, it is an air polishing device which fully can be autoclaved. Not only the tip or the grip sleeve, but the complete instrument can be autoclaved. Yes, the question is, are the instruments available, products available in India? Of course. Again, contact the distributors or KaVo Kerr India. So there is a question also about the Diagnocam in hygiene reprocessing. Of course, the sleeves of the Diagnocam can also be autoclaved. Not the camera itself, but the sleeve can be detached where the grip area is and the area which is in the patient mouth, and all this can be autoclaved as well. If you like also to educate yourself more about the hygiene maintenance, please have a look in a few days into the webinar about the hygiene maintenance of KaVo instruments. We follow since years the very strict requirements to reprocessing of dental instruments according to the Robert Koch Institute guidelines, which are relevant as a law here, for example, in Germany, and they cope with all additional requirements we do have during our very specific pandemic situation during these days we all are facing in. That means you can provide a safe treatment. There was another question, and with that I see I would like then to finish if there are no more questions. Can, for example, the Profi Flex and the Sonic Flex be adjusted also to turbine couplings of other manufacturers? Yes, they can. You can have the Profi Flex 4 and the Sonic Flex in Zerona click and go version available as well. But of course they match to the KaVo Multiflex turbine coupling. That means even with only one air connection on your treatment unit, you are flexible for both, for the restorative work with the turbine and also for the polishing work and scaling work in prophylaxis.